So let's break down EMDR therapy. My name is Dr. Greg Donahue. I'm a licensed therapist and trained in EMDR. Chances are, if you've done therapy or been around someone who has done therapy, they've mentioned EMDR at some point. EMDR stands for eye movement desensitization and reprocessing. It is one of the number one clinically studied models that is effective at treating trauma. So, basics of EMDR. What is it? It uses something called bilateral stimulation, which simply means you stimulate your brain on either side. Is this complicated? No, it is very simple. It usually involves eye movement, thus the name eye movement desensitization and reprocessing. Eye movement where your eyes will go back and forth, either following a light or someone's fingers. Could be done online or online or in person. Works the same. As long as your eyes cross the median point, you're activating right lobe, then left lobe, right lobe, back and forth. The benefit of this: trauma is uniquely stored in one lobe of our brain at a time. Normally, memories are mixed and crossing back and forth between both sides of the brain, but with trauma, it is locked into one side in a neural cluster, and that is part of the mechanism that releases the amygdala and the limbic system for fight or flight. So the theory and the practicality of EMDR is to trigger an emotional memory that highlights on one side or the other where there's a traumatic memory that is clumped together. One of the mechanisms to get it unlocked from the traumatic cluster is to force it onto the other side of the brain through stimulating both sides of the brain while you're processing the memory, thus writing the memory on both sides of the brain. What does this feel like when you're doing it? Well, it feels like deep meditation where suddenly your perspective opens up and a memory that was traumatic suddenly starts to be blended with all of your other memories and perspective. And suddenly it doesn't feel so traumatic anymore. It's hard to explain unless you're doing it, but I highly recommend you look into it.